So what I'm doing here now is I'm going to withdraw the Botox from the little vial that has the Botox in it. So I use a really tiny syringe. It's a 1 cc syringe, and I use a 30 gauge needle, so that's very tiny. So although you do get poked with a little needle, you can't get Botox with a little needle. It's extremely small. The vial, basically I withdraw the Botox from the vial that it comes, the Botox comes in from the company, and I measure. It's very precise how much I give the patient. It's measured in units, so when people talk about how much Botox you got, it's in units. When people talk about fillers, we're talking about cc's, so they're different things. So it's a very tiny, very precise quantity. So what I'm doing now, so this is a patient, everybody that I have photographed has given me permission, and this is what's called the glabellar area, the area between the eyebrows. What I'm demonstrating here is one of 4 injections, so that this is coming up to number 2. And again, it's quite painless. Sometimes it can sting a little bit because it is a needle. It's 3, and in a second there's going to be injection number 4. Sometimes I'll vary the position. If you notice, sometimes you get a drop of blood, sometimes you won't. Most patients, almost none, will bruise in this area. I just put a little pressure on it for a few seconds, or have the patient hold it, and that's basically it. I believe they can go out, leave my office, and do whatever they want afterwards. They can take a yoga class, stand on their head. What I'm demonstrating here is a small injection above the medial eyebrow. If you put a very low dose above the eyebrows in the lateral third, you'll get a slight brow elevation for most patients. She has some lines in her upper forehead she doesn't like, so I'm injecting them as well. How much Botox I put, where I put it, will be vary from patient to patient.